Hello friends, welcome back. In this video lesson, we shall be taking a quick look at the medical trends today. Medicine has advanced tremendously, especially over the last 1 century. But it's a good time to take stock of the situation to see which areas of medicine advancements have taken place. And that will help us to review it in the correct perspective and find out which are the areas which need to be supplemented with homeopathy. Let us take a look at the annual global spending on various things. I'm not talking about arms and armament and stuff like that. I'm talking about something that pertains to our discussion: food, medicine, and other medical expenses. In the graphic that will come up, you will find that the sector in green represents expenditure on food, and we are talking about annual global spending on food. In red will be medical, yellow will be wellness expenditure, and health foods will be shown in blue. The total amount of money spent on food across the world is almost 7.5 trillion US dollars. But if we look at the expenses on medicine and medical facilities, the total medical expenditure is more than food. It is 7.8 trillion, or almost $8 trillion. That's quite surprising. We are eating more medicine than food. Food is essential for life. It provides nourishment. It sustains societies. But that expenditure is already lagging behind medical expenditure. This does not include expenses which are incurred for wellness. Wellness is visits to spas, massages, and so many other things, including medical tourism for improving health. That comes at the third position, and health food, that is supplements and other dietary requirements which are taken for the benefit of a person, amount for $1.2 trillion. So once again, as of 2017, there is more expenditure on medicine than there is on food. If you're interested in exploring these figures further, here are some references which you will like to see. They are from very authoritative sources such as the World Health Organization and Statista.com, which is another very reliable source of information, especially when it comes to statistics. Medicine advancements in fact are very mind-boggling. If you look at the microsurgery, laser surgery, and so many other things which save lives. But let's go a bit deeper. The main areas of advancements have been vaccines, antibiotics, pain management. These are three major areas. Vaccines, as we know, help to prevent disease, epidemics, and so many other things which mankind suffers from. But vaccines bring with it the ill effects of poisoning due to mercury and aluminum. It is also said that there is an association with autism and schizophrenia. We shall be looking at vaccines and homeopathy in a later module. Antibiotics bring with it resistance to antibiotics. The very germs which are supposed to be destroyed by antibiotics develop resistance to those agents. And increasingly, we are finding that we are in the midst of a crisis where most current antibiotics will at some point in the near future the bacteria will become resistant to those antibiotics. Pain management, of course, has advanced tremendously, and people are in great relief, especially in the management and care of cancer. But it's also leading to an opioid crisis due to its overuse. There is a separate module for pain management, and you can take a look at it later. Let's take a look at the leading cause of death. I'm just discussing the numbers for US because the data is very well documented and easily available. And this is from the CDC site, which is a government agency. This appeared in the Annals of Pharmacotherapy, volume 46, issue 2, and I've given the page numbers also. If we were to look at the first top 4 causes of death, leading causes of death. Heart disease ranks number 1, followed by cancer, stroke, and did you know that at number 4 we have deaths are caused by adverse drug reactions or ADRs. We shall be looking at that also at greater depth in a later module. But if we take a look at it from a different perspective, we will find that amongst the top 3, heart disease still remains number 1, followed by cancer. But if we combine adverse drug reactions with medical error, mistakes made during medical procedures or in other medical practices, then we find that the ADRs and the medical error is number 3 killer in America. The very procedures and medicines which are supposed to save lives are in fact a cause of disease and a leading cause at that at rank 3. We have seen so far the leading causes of death. There is another way of looking at death, and that is by looking at actual causes of death. This concept was first brought up in this paper, which was published way back in 1993 in the Journal of American Medical Association. In the graphics that come up next, you'll see some figures which I have updated on the same principles as published in this paper for the year 2000. As I mentioned earlier, the leading cause of disease is heart disease, followed by cancer and by stroke, and then of course the other disease. But if we take into consideration ADRs and medical error, that becomes number 3, and it's much more than stroke. Coming back to the concept of actual causes of death, here are the numbers. The actual causes of death in the United States, the leader was tobacco, followed by poor diet with combination of physical inactivity. At number 3 was alcohol consumption, followed later by microbial agents which cause influenza, pneumonia, and other diseases. Toxic agents were at number 4, followed by motor vehicle accidents, firearms, and other things. So remember, the actual cause of death, the leader is tobacco, and if we see the numbers for over the course of 10 years, there has been no change virtually. At the present moment, despite all the medical advances, we are still talking about incurable diseases, and by that I don't mean any strange things which you are unaware of. These are common everyday disease which you see, encounter, or even suffer from, for which modern medical science or allopathy has not provided any relief whatsoever. They still remain officially incurable in their own literature. These include asthma, Alzheimer's disease, arthritis, cancer, common cold, diabetes, epilepsy, fibromyalgia, irritable bowel syndrome, influenza, joint pain, multiple sclerosis, Parkinson's, and osteoporosis. This list can go on. This is just a random selection of some names of disease which are still incurable according to modern medical literature. So we have to ask a question, is it possible or is it impossible to find a system or some medicine which is safe, which is effective, which has a lasting effect, which is affordable, and which is patient-centric, which takes the human being as the center of focus. You might be wondering that we are waiting for a discovery in the years or decades to come. But we forget that it has been in existence for the past 250 years. And that is homeopathy. Homeopathy, of course, was started by an allopath. It is a complete medical science, and its areas of specialization, or you can say effectivity, are in certain particular fields. The conditions which can be treated very effectively by homeopathy are those which are of allergies like asthma, hay fever, those which are infective disorders like tonsillitis, abscess, otitis media, and the list goes on. Or if they are metabolic, where your endocrine system is involved, diabetes, lactose intolerance, for instance. Or they could be disorders of the functional nature, IBS, PCOS, COPD, and the list goes on. And so-called irreversible diseases such as hernia, cataract, baldness. Although it may not be able to find a cure for that, they can certainly provide management. One must remember, of course, that like in other medical systems, homeopathy, to be effective, is affected by certain factors which can help or hinder cure. For example, causation. If it is genetic, immunological, or metabolic, that is going to affect the outcome. It might delay, or it might disturb, or it might make cure difficult. There could be maintaining factors which aggravate and which must be taken care before effective cure can take place. There could be environmental, use of cosmetics, and so on and so forth. Current medication, as we have seen earlier, or the adverse drug reactions themselves could be causing certain symptoms of disease or even disease themselves. For example, it is very well known that beta blockers will obstruct the cure of psoriasis. Lifestyle, of course, as we recognize today, is a major contributor to factors that affect the path of cure. Smoking, alcohol, drug abuse, and so many other things can actually hinder treatment or cure. And lastly, patient participation is very necessary. If we remember these things, it will help us to find how we are going to effectively use homeopathy. Patient participation requires compliance, follow-up, and so many other factors which are common to any other field of medical practice. Now, what are the conditions which benefit from homeopathy? The list is long, but here are some samples. Ear infection, sinusitis, tonsillitis, bronchitis, asthma, diarrhea, constipation, canker sores, sciatic pain, in knocks, falls, injuries, recurrent boils, period disorders, migraine, thyroid problems, teething problems, learning problems, sleep disorders, palliative care in chronic diseases is yet another area of specialization, and we shall be looking in a module that comes towards the end of this course, which is on elderly care and end of life care with homeopathy. So friends, that brings us to the end of this lesson. I hope you have taken note of the facts, and you can always revisit this lesson as often as you like. Thank you for your attention and meet you in the next lesson. Bye bye.